The published data has indicated that persons who suffer from COVID-19 might fully recover or might experience symptoms related to COVID-19 several weeks after the acute phase of infection. Here is the experience of the COVID-19 survivor.
Hello, I'm Sabina Sigdel and I'm 30 years old. In October 2020, I was diagnosed with COVID-19. I had mild symptoms including fever, headache, muscle pain and respiratory symptoms like common cold and cough. Fortunately, I didn't need to be admitted to the hospital. I kept track of myself and took care during my home isolations. I thought I would recover after 10 to 12 days of isolations, but it took me around 22 days to get a negative test result. Even after being tested negative, I still suffered mild fatigue and general feeling of weakness. I wasn't feeling well and I couldn't focus effectively on my work. I had heard from my friends about this post-COVID-19 symptoms, but I didn't know how long it would last. It took me around 1.5 months to get recovered completely from COVID-19 and its associated symptoms. My other friends have also complained of having similar symptoms even after being tested negative after 2 weeks. They complain of having headache, muscle pain, fatigue and general feeling of weakness. I believe that having a good understanding of post-COVID-19 symptoms and how to treat with them is critical in dealing with these health conditions.
Let's hear more on COVID-19 long haul syndrome from the perspective of clinical epidemiologist Dr. Erwin Calgua from Guatemala. So, Dr. Erwin, as per the case story we heard, can COVID-19 become a chronic disease?
Well, yes, COVID-19 actually can become a chronic disease. And that's important for everyone to understand that once you've been suspected or confirmed as a COVID-19 patient, if you experience more than 2 weeks after the end of the quarantine that you have or isolation you have had, and you keep on having symptoms, and this goes to pretty close to 12 weeks, that basically makes you a post-COVID-19 patient or persistent or long-haul COVID-19. If it goes more than 3 months, you can actually think that it becomes chronic based on the symptoms of fatigue, difficulty when breathing, even having memory dysfunction, and that's the kind of symptoms that you will experience. And of course, that could be in a chronic phase.
How prevalent is COVID-19 long haul syndrome?
Its prevalence is not totally well known. So far, the studies have mentioned that it can go from 10 to 35% of the population that has been confirmed with COVID-19 infections. Some studies even go to 75% with some of the symptoms. But so far, we can feel very comfortable in saying that the usual prevalence is between 10 to 35% of the population.
So, what are the possible causes of COVID-19 long haul syndrome?
About the possible causes of long-haul syndrome is basically the fact that there are ongoing studies of what the etiology. Actually, it's one of the things that the National Institutes of Health in the United States are doing. They're investing in knowing what the etiology. The only thing we know so far is that it's definitely an entity that comes with the contact of the virus, the COVID-19 virus. So we don't know actually what the etiology is, and we are still trying to study it.
Are there any comorbidities associated with this disease?
Long-haul syndrome in COVID-19 is something that is associated with patients that can have or don't have comorbidities. That's one of the most interesting part, because you can have very young people with a previous healthy life that had probably a mild form of the disease, and you ended up in a long-haul syndrome. You can actually have other people that have had renal problems, cardiac problems, respiratory problems that can actually develop long-haul syndrome. So it's not linked at this moment to a specific comorbidity.
How common is this among children and adolescents?
Well, in the children population, the interesting thing is, yes, we have had long haul syndrome in them. And that's something important to bear in mind. And actually, that's a very important issue that's been approached right now by those that take care of the pediatrics community about long haul syndrome and COVID-19. So one of the things is we know that it happens. It is less frequent because the infection in disease is less frequent. So it's not as in the adult population, that's for sure. And it actually can be linked to MIS-C, which is this multi-inflammatory syndrome associated with COVID-19 that can actually express that and develop into a long haul syndrome.
So, Dr. Erwin, how do we diagnose this COVID-19 long haul syndrome? Are there any diagnosis or medical examinations for this?
Well, one thing important for those that clinically are suspected of long haul syndrome in COVID-19 must understand that they have to undergo a new protocol, which is in development. As a matter of fact, a lot of institutions, there is not a protocol that has been agreed, or there's a consensus in the community about this long haul syndrome, how you diagnose it. But what we know is because it's a multi-system disease, you need to do a lot of studies that are usually more complex than the initial COVID-19. So it means you have to go through laboratories from multiple systems and organs. You have to go through different radiology studies, and you want to be able to have a multi-group that can actually look at your case and work it together to have a whole information of your body so that you can make decisions on how you handle long haul syndrome because of its complexity.
So how long will this COVID-19 long haul syndrome last?
Well, in regards to how long it takes, we don't know how it can last. We know this. People can actually have even a year or a little bit more a year. It's not as frequent, but it can actually last more than a year. It's interesting to know that most of the patients probably last between 6 months to 8 months. And it is one of the things that happens is usually can experience that the symptoms lower by themselves. Actually, they begin to diminish the burden of the symptoms without actually having much treatment. And it can happen between 6 months, but you can actually experience this for more than a year.
Is there a treatment for this syndrome?
One of the challenges that we have with long haul syndrome is about having a treatment. We don't at the moment. We know that it's linked to your activity. So at least it is usually recommended for you to rest as much as it can be. And of course, since there are symptoms, you treat every one of them, of the symptoms by the medications related to what you're feeling, if there are symptoms. But what we can say, actually, at this moment, we have, I don't know, it's like a specific treatment, pharmacologically treatment. We don't have it at the moment.
And is there any relationship between vaccination and COVID-19 long haul syndrome?
Well, that's one of the most interesting questions that we have right now, because we have an ongoing vaccination plan in progress around the globe and in local communities like the one that I work in. And you have to bear in mind that we have a little bit of information on this, but vaccination has been linked to, one, lessen the symptoms. Second, it actually, and there are some anecdotal experiences when people that has vaccinated, it actually has stopped the symptoms to express in the patient. So it looks, and we have hints that vaccination, it actually can prevent the long haul syndrome by itself. And if you have it already, it can actually diminish the symptoms that you're experiencing.
So any key points to share with our audience about COVID-19 long haul syndrome?
Well, I believe that an important part that long haul syndrome has is people don't believe it exists. And one important thing to bear in mind is, first of all, once you know that you are basically experiencing symptoms more than 2 weeks after like your isolation or your quarantine, you feel bad and you feel fatigue, difficulty in breathing, you feel that there is difficulty or palpitations in your heart, then you have to think that you might be experiencing a long haul syndrome, and you should seek your physician. And the physician, which is the other thing that we want to be able to share, the physician also needs to think that we have the long haul syndrome as a possible diagnosis, and it requires a multidisciplinary. So I think in this case, we need both the patients and the medical doctors be aware and don't wait for that. And I will say, as we've discussed here, vaccination is very important. So if you need to get the vaccine, the 2 doses, because that will either prevent, or we have reasons to associate this to a remission of those symptoms, and be able to, above all, try to not to get infected by basically using your mask and keeping the mitigations as is recommended in your countries.